Christmas party here on the link, and we wanted to bring in public health because these guys have been working so hard throughout the year, and they're continuing to work even today. So thank you guys. We've got in the Zoom room Annette Uggan and Public Health Director Artson Augustine. Merry Christmas to you guys. Thank you guys for coming on to the show. We brought you on because we wanted to get, just the very latest. You guys had the vaccination clinic. You had mass testing this week. So if you could, let's just start with you, Art. How are you feeling? Because you were one of the first to join the vaccination.
Yes, first of all, thank you for having us this morning, and Merry Christmas to your team as well from Public Health and Social Services. In terms of how I'm feeling this morning, very encouraged and continue being very hopeful. Yes, I was one of the first three from Public Health to be given the vaccine, and we're really hoping that the community will come forth as they're given the opportunity to also be vaccinated, so that we're just one step closer to containing, controlling, and really moving to some semblance of normalcy in the coming months. We don't have all the vaccines yet, of course, as everyone perhaps already knows that. Our first apportionment of vaccines from Pfizer did arrive. We received 3 boxes, 11,700 so far. And that would be able for Public Health to immunize 5,850 Guam residents. Of course, in line with our CDC guidelines, which the Vaccination and Antiviral Prioritization Planning Committee, which we just now refer to as a Vaccination Committee, is now going to be using to determine the next group of individuals on Guam that will be offered the vaccine. In terms of what we've done so far, we vaccinated 2,152, along with Annette and the other members of our team. We had our healthcare this past Tuesday. We really gave a 4th-day opportunity for healthcare providers, and from that was kind of our cutoff date. Now, when I say cutoff, that just means that allows us now to move to the next group, which we did too in terms of 1A. We went to our elderly population in assisted or long-term care settings. And so we're looking at St. Dominic's, the Mercy Care Center and Convent, and those types of settings. And so we've got that started yesterday. And what we wanted to do was complete as much as possible 1A. And our healthcare in 1A also includes GRMC and GMHA. And that makes up part of the 2152 or 2,152 individuals on Guam that have received the vaccine. By completing or moving from 1A, we're able to move on to 1B. And so we're moving into 1B, which is our population of Guam residents, 75 years of age and older. And we'll be starting that vaccine clinic on Monday, Tuesday, and Wednesday, but starting Monday at the Okadu High School. And our time is from 9 to 3. We also have collaborated this Tuesday with the Mayor's Council of Guam. They are engaged, and they are the registration sites for their residents. Their respective residents from the varying villages can register with the Mayor's Council of Guam. with the respective mayor at their village, and that list will be provided to Public Health. And that will be our registration for our Manamko, for our elderly, 75 years of age and older. You said, I'm sure Annette has more information and perhaps other points, but that's pretty a quick overview of where we're at right now.
You said the congregate settings for the elderly. So you guys did go out to St. Dominic's, just for clarification.
Yes, St. Dominic's was offered the opportunity to be given it to their residents and their staff. And yesterday, 67 were given the vaccine, received the vaccine, 27 of their 40 residents. And again, this is all voluntary. So I'm working with Sister Manalato. She was surveying her 40 residents who would be willing. And so 27 were given the vaccine yesterday and 40 of their healthcare workers.
Were there any adverse actions reported?
Yesterday, no. There were no adverse actions reported. I'm not sure if Annette got anything after the report was provided to me, but Annette, did you get anything on adverse from yesterday? I didn't get any reports of any adverse action from yesterday.
I did want to ask, since we did have Gura on yesterday, Ray Tapasnia, are there any plans to vaccinate the residents over at Gumamami?
In terms of like perhaps Guma Tranquilidad.
I'm sorry, not Guma Mommy. Guma Tranquilidad. You're right.
No. I'm tracking you. Yes, because Guma Tranquilidad is another elderly congregate setting. So Guma Tranquilidad and also the GUR 82 projects are in discussion with public health team to also assess the possibility of offering the vaccines to that population as well.
Mm-hmm. And so
that definitely is on the list of considerations, given there are seniors there as well. And so we're looking at that congregate setting. We just want to be sure that it also has an assisted living and a long-term care characteristic so that, qualify under the 1A. But we're definitely looking at that.
Mm-hmm. You mentioned registering with village mayors. Can they do that over the phone, or do the Menamcos have to go physically to their mayor's office to register?
Yeah, the mayors, when I spoke with them, what I've got some feedback is that they're going actually through the list of their village residents, and they're also identifying through that list, and they're reaching out to them. But definitely, you can call into the mayor's office. I spoke to a few individuals who actually shared that they did contact the mayor registered their parents. And so they seem to be taking walk-ins and reaching out and also listening to phone calls. So I want to thank the mayors who were at the meeting, but also for being very collaborative and being our partner in this effort.
Mm-hmm, mm-hmm. How many, do you have a rough estimate on how many Menamco?
The data for a little over 75 years of age and older. But as I was reading the article, that was reported, and some of the mayors who are reaching out, I think one said they have, 110 residents they've identified in their village who are 75 years of age and older, and about 31 agreed to be vaccinated. Some are basically saying, no, not at this time. One reported feedback I received is waiting for Moderna. So again, even with our healthcare, some have agreed. Some of the healthcare, as we all know, there's going to be some that are not willing yet to take it. Some are wanting to wait until us have taken the second dose and seeing if there's any further adverse reactions after the second. Mm-hmm. So some people are waiting and just to see how things roll out in adverse.
And okay, Art, I had a question. When I know it's a little bit down the line, but when we do get to vaccinating the general public, is that going to be just a, hey, we're open, first come, first serve, or are you going to go alphabetically, or is there a system in place to kind of go through the numbers? How is that going to work?
When we get to the general public, a couple of things are going to happen. We do have enrolled providers. I believe Annette, we can add more to this. There's about 22 enrolled providers. And so they too will be able to receive the vaccine at their location and administer to their patients. And public health will also operate mass vaccination clinics. Once it's open to general public, it's my understanding at this time. And again, things may change as we recently received guidance on 1B from the Advisory Committee on Immunization Practices, ACIP. Just this week, as an example, we received a new definition, new category for 1B. 1B was our workers, and then just this week, we received email, and 1B is now the elderly and our essential workers, 75 years of age and older. So the ACIP is redefining the recommendations, updating those recommendations, and we'll follow those. The committee also in Guam, the vaccination committee, will also be the ones to help determine the prioritization. In terms of the mass, my sense, it's going to be basically, we'll let people know how many can come in per day. We may actually do a pre-registration or a walk-in. But like we've done in mass testing, if we say we can do 400 per day, of course, we'll monitor the number of folks in line and let people know that you're number 400. And so at this point, if we could ask you to return back tomorrow. So we don't want people standing in line for hours only not to get the vaccine. Right?
But yeah, we don't want people lining up and then, oh, sorry, we're out, come back, some other day and try your luck. So yeah, it's right. Just, a lot of people are in the general public that want to get vaccinated are just wondering, I know I have to wait my turn, but when is that going to be and how's it going to work?
Right. And that is a good question. And part of that in our response, simply based on the number of things we get on Guam, we have our full September apportionment of the Pfizer vaccine at 11,700. We're still waiting on our Moderna to arrive this month. We received confirmation. I received email confirmation copy this morning that Moderna is on its way, but we don't actually have the exact arrival date just yet. We're expecting it in the coming days, though.
Okay. And I had one more question. Have you guys seen an increase in like accidents from sweet wrapping paper lightsaber accidents? Because I finished wrapping all my paper and I have this sweet lightsaber. No, I just want to be safe.
No, I actually have not seen an increase in that. But,
okay, good.
But thank
good.
you for asking.
All right, no problem. I just want to get the info.
Thank you. Thank you.
Okay. So we had GPD. We talked to the police chief earlier this week during that press conference, and one of the reporters, I think it was Kenson Nicholas, actually from KUAM, he had asked the chief about vaccinations within GPD, and the chief was talking about how he had a conversation with you, actually, just minutes before that press conference, about trying to move up police officers in the priority. Where are we with that?
Well, my position at this point, or at least the plan at this point, is that we'll have another vaccination committee meeting on Monday, and we'll again ask the committee to help identify, or basically work their job, and part of my job on the committee is really to facilitate and make a decision as to the ranking of the next essential group for essential healthcare workers, and it's the police department is up there. We've got consideration for the individuals working at the airport, the team at the airport, under the police, the CQA. So varying agencies are on the list. We've had actually requests from other entities to be considered as part of the next group. And so the committee will look at the request and also the function. And that's really key, is are you a frontline essential worker that we will need to provide the vaccine opportunity to, or the offer of being vaccinated. So definitely the police department is on the list. We actually discussed it a bit this past Monday, but at the end of the meeting, the committee decided that we will just at this point go with our 75 years and older population, our elderly, and that we would further discuss the essential critical workers at the next meeting. But definitely they are on the list. We have them. Their tier 1 is at 280. And I did speak with the chief, and seeing if that number are 280 officers, or is it 280 officers all responding to COVID-19? So he and I are in discussion on that. But the committee is, I imagine, going to meet on Monday, and we'll hopefully have direction in terms of the next prioritization of our Guam law enforcement and other entities that are on the list.
You said airport, Port Authority also?
Port Authority is also on the, every government agency was asked to submit their tiers, tier 1, 2, and 3. Tier 1 being if you needed to just identify your critical workers to be vaccinated, who would those be? And so it really wasn't a list of names, it was more of a number. So we would plan for how many vaccines we have and the numbers of individuals under tier 1, 2, and 3. And so people in the front line, critical to the operations, health, welfare, and safety of our island would be the ones that we would ask the managers, executive directors, agency directors, private sector to identify those individuals as tier 1. And that's what the committee just has to meet on Monday. I'm hoping that we can have a meeting on Monday, and we'll be sending that request out later today, and so that we can also come to a planned approach in terms of what the next group, or who the next groups are to be vaccinated as the vaccines become available.
And so you said the next vaccination clinic is scheduled for Monday, Tuesday, Wednesday? Is that what you said?
Correct.
Of next weekend?
That is correct. And that's this coming week, Monday, Tuesday, and Wednesday. And it's for our population of 75 years of age and older. And that's from 9 a.m. to 3 p.m. It's at Okado High School, and it's pre-registered with the mayor's offices from the varying villages. So we'll be getting the list. And one of the things we'll be asking our elderly, of course, is for just ID to verify their age at 75 and older. They will also be able to be assisted by a caregiver or a family member or a friend if they should need assistance. And we'll also have staff on site as well.
What about your staff? Has your staff all been vaccinated?
No, actually, no, not all of public health has been vaccinated. The focus has been on our healthcare provider in public health, our nurses, our physicians, and also our team working at the isolation facility, the quarantine facility, as well as those working at the dispensing pods, the pods where we're actually administering the vaccines, and the test sites. Mm-hmm. So those that are the front line, so our secretaries, our payroll clerks, and folks that are not at the front line have not been vaccinated. Unless if they're in that position and they're out there assisting and have been detailed and assigned to assist with the vaccination site or the testing site. So they've been detailed. You might see an admin assistant or an admin person position vaccinated, but only because they've been assigned away from their duties as a payroll person or an admin assistant over to assist with the vaccination sites or the test sites, mm-hmm. or have been assigned to assist with the operations of quarantine or isolation facilities. And so those folks, of course, they would be offered the vaccine at this time.
Mm-hmm. And since you mentioned quarantine, are you guys looking at any changes to the quarantine protocols?
At this time, we're staying with the 14-day approach, but we are doing the test on day 6. We can do the test on site as well at this point. So what's happening right now, as recent as this week, is if you test on site at the quarantine facility, and of course, hoping it's a negative, then you could be transferred to home quarantine from that day on. But at this point, we're still, the latest I saw was December 8th, in which CDC still endorses a 14-day quarantine period. Mm-hmm, mm-hmm. And so we're staying at this point with that approach, but we are discussing other approaches, including travel protocol that would then affect the quarantine options or protocols. So there is an ongoing discussion about how and what we could do to continue to interrupt any transmission, to monitor and quarantine, but how would we do that in the coming weeks, coming months? So there is conversation on that at this time.
What about mass testing, mass community testing? Is public health planning any other opportunities for people to get tested?
Actually, yes, Sabrina, the team right now is just this past Monday, mm-hmm. I believe.
Yeah, Monday.
That was a Monday that we did, Monday, right? We did testing, we did mass testing. We had 2 sites, Micronesia Mall and Teasdale, each at 125, total community tested that day was 250. So we're continuing with scheduling for the mass testing. We're continuing with of course, the administration of the vaccine at our vaccine clinics and with our partners, GRMC and GMHA at this time. And then we're also continuing the testing at the Northern Region Community Health Center. And so we've got all this going on. But testing and the vaccination are happening on different days because we have some of the same team members that are assisting with the testing for mass testing, as well as those that are doing the pods for the vaccine administration. So we have some of the same team members. And so we're also looking at once we get a good feel of community response in terms of wanting to be vaccinated, we're also exploring the possibility that we would divide the team into 2 groups. One team is focused on just the vaccination activity and one on the Binax testing activity, mm-hmm. or community testing. Mm-hmm. So we're looking at that, and we'll also be looking to explore with other partners in terms of how perhaps they can assist us with both activities.
Mm-hmm. Well, are you guys also looking at possible rapid testing over at the airport?
You know, that's one of the other, and I noted earlier about like how we're looking at the protocols of arrivals. And so yes, we're looking at testing at the airport. That's at one point of discussion. Yesterday, we met with Mary Rhodes, who is with the Guam Hotel and Restaurant Association, and we're also speaking with her about testing also in terms of a reopening with the Guam Hotel and Restaurant Association in a very moderate pace. So she is very encouraged yesterday, and so it was our first in-person meeting with her. And we'll be having standing meetings with her to plan more. We'll have more discussions on how we would partner with them from the public health side in terms of them wanting to and needing to, in our community, really needing that reopening eventually. So we're partnering with Guam Hotel at this time. And it was a good meeting with Mary yesterday and my team, and we're very encouraged. And she's got some plans that she's going to be sharing with us. She's developed a safety officer concept with an education component, which is very critical. And any time we're wanting, yes, we've got the mass testing, we've got the vaccines here, but we need to continue the education component. We need to continue our mitigation measures, wearing the mask, washing our hands, maintaining our distance. And of course, as many have added on, the willpower. And we've done a great job with the numbers and where we're at right now. We've got to keep this steady pace and just keep it until we get more vaccines on Guam and we're able to immunize more and more of our members and our residents and our family here in Guam.
Right. And I think that's also important to like you said, the message, although the vaccine is here, we still need to practice all of the W's and still, right. Go and get tested, participate in the mass testing every time they're offered, because we're not truly out of the woods.
Yeah, you're correct. You're very much correct. You're right. Mm-hmm. And so, yes, and I want to thank you all because although we have many Zoom calls, one of which is with you this morning, which is fine. But yeah, we can pretty much, Zoom has been a blessing, but it has also kept us extremely busy. We are Zooming throughout the day. And it's just, it's amazing. It's like you have like 4 Zooms, one right after another. But you know what, it's important right now that we maintain as many of those Zoom, as many are related to, of course, the planning and response of COVID-19.
Mm-hmm. Yeah, I think we lost.
Oh, there, we got him.
We got Annette.
Oh no, Annette's on the phone.
I didn't know Annette was on the phone. Annette, are you part of the vaccination? Did you join?
I have yet to receive it.
Not yet. Okay.
But
well,
I will.
Yeah. Well, this has pretty much been, your show because immunizations is your deal, So how are things going on your side?
It's been good. We've had a lot of support, again, from our director and our internal leadership as well as from the administration. We do have a lot of partners wanting to assist with vaccination, like Guam Pharmacy Association, University of Guam. They have already offered their assistance, so we will be definitely bringing them in to help augment so that we can provide more immunizations. Our private sector partners have really stepped us as well. We have more who are wanting to enroll in the program so that they can provide it to their patients when we have more doses available. And GMH and GRMC too have really stepped up, and daily they've been immunizing their staff, and so we appreciate that. And we've been getting a lot of phone calls as well, and interested in getting it. And so again, we do ask for people's patience as we slowly pull up the priority groups first and expand out to who we can immunize. And so we do thank everyone for their patience, their interest in the vaccine, and again, continuing, as my director mentioned, the 3 W's, because again, it's a combination of these tools that can help us keep, flattening the curve and help our government ease some restrictions, and see that light at the end of the tunnel, and so again, we have more work to do, but again, we will continue to pull up the different priority groups, immunize as many as we can so that we can build up that immunity across our residents here on Guam.
Mm-hmm. There's been several reports, I'm sure you guys are aware of this new variant new strain of COVID. How concerned should we be?
Well, actually, it's too early for us to say. I do know I was reading up on the manufacturers for Pfizer and Moderna vaccines are already testing their vaccines against this strain because there is discussion that it may still be effective against this variant or mutated strain, because if it's just a slight mutation, then it should still be effective. So we want to wait for the science and the research and the accurate data just to see whether we can continue on using what vaccines are already approved, or is there a need to update it? And that would be something similar to the annual flu vaccine. That's why every year we would have to get it, because the flu virus does change a little bit, mutate a little bit over the time, and so every year we get an updated version of the vaccine. just to see what's circulating around the world. And so that's what, with science and the vaccine manufacturers, they use that data to develop the new annual flu vaccine. So that would be similar, where we continue to monitor, conduct surveillance throughout our region, nation, and around the world. And again, it's a global effort in regards to developing a vaccine for a virus that has global implications like the flu and the coronavirus, COVID-19.
As you guys prepare for the next vaccination clinic for our elderly population next week, Monday, anything that they should know or their families should know as they make their way there?
Oh, yes, that's a very good question. Thank you, Sabrina. We definitely ask them to hydrate. If they have to have any medication, to definitely eat. We will assist them so that it's a smooth and as process and as quick as possible to get you in and out to be vaccinated. We are working to rearrange our flow to accommodate should anyone need a wheelchair. We are also working to have additional wheelchairs on site to assist them, for the distance between the stations. We do ask if you have someone accompanying them to assist them if they need translation or to ask certain questions that this individual can assist them. And again, it would be the same guidance that we provided for our healthcare personnel. If anybody is sick, has a fever, any symptoms, please don't come until it's resolved, because we will turn individuals away who have symptoms or fever, because again, we do not want any exposure. Or with any vaccine, be it COVID or the flu or any other adult immunization, there is a chance of a slight fever if when you receive a vaccine. So if you're already sick, we don't want to exacerbate that with the vaccination. Again, we don't want our staff to be exposed to anyone who has symptoms. If you've had another vaccine within the last 14 days, again, we continue to push out for annual vaccine. My uncle, they recommended to get the pneumonia vaccine. If you've had a vaccine within the last 14 days, you should not come to get the COVID yet. You need to wait until after 14 days from your last vaccination, because again, we want to space these vaccines out. COVID vaccination was not, as we say, co-administered with other vaccines during the trials. So again, we want to be as safe as possible to anyone receiving the vaccine. And then, if there's any concerns, if you have any questions or doubts, speak to your primary doctor. They know your medical history better, and get guidance from them that should you get it based on your medical conditions or any allergies. We will have doctors on site to further guide as well whether you should get it or not. But having that information ahead of time, your doctor could say, no, you shouldn't get it due to this condition or that medicine. So, you don't need to worry about having to get into that line and coming when you would be unable to receive it next Monday, Tuesday, or Wednesday.
I got a question, and sorry, it's Vic here. I have a question. I love that you mentioned the fact that I guess we'll have doctors on site to help, kind of educate people before they take the vaccine. But how about before? How about for those who don't have doctors? We talked when we started talking about the vaccines. I know Andy, and Sabrina and Jason and Joe Sir here was saying, we talked with our doctors. But how about for those who don't have doctors?
So for any individual that comes in for vaccination, we do have a consent form that needs to be filled out, and there's also screening questionnaires. And for Guam, we have more screening questions that we ask each individual than is recommended from CDC. So we're taking those extra precautions by adding in more screening questions in regards to people's health or conditions, allergies, and then if there's any questions or if they have any yes in regards to medication or allergies, we will definitely have them go to the station where our physicians are at to do further evaluation, and they will talk to the individual and determine whether yes or no they should get the vaccine. So even if they don't have a doctor, yes, they can come to our outreaches. We have a doctor available on site to help guide each individual with whatever medical concerns or questions they have.
Oh, that's awesome. Thank you so much.
You're welcome.
Thank you, Annette. Thank you, Art. Any final message before we let you guys go?
Sure, Sabrina and team there, if I could just take this opportunity, again, thank you for having us. If I could just also say to the team and our partners from Public Health and Social Services, I wish all of you a very Merry Christmas, blessed, come and just wish them all the best. I want to thank them for the continued dedication and commitment to assist in the response to COVID-19. And really, this is not an I approach, it is a we approach, and we as a team are making a difference. And I really want to thank them, everyone that's partnered with us, both local and federal. And as I said at one of the meetings of the pod, even our media for helping us get the word out, getting information out, and giving us opportunities at times to even clarify misinformation that's been sent out. So really, Sabrina, and to your team there, thank you so much for having us this morning. And Merry Christmas.
Merry Christmas.
Merry Christmas.
Merry Christmas.
Merry Christmas.
Merry Christmas. And you guys stay safe. Thank you for your dedication as well and everything that you guys are doing. We are going to stay in the Zoom room where we have Crystal